Since we are seeing the loss of food stamps this month, perhaps this is a good opportunity to turn our attention to the program itself, seeing that many of us have probably never looked into how this system works. I hope to show you it's part of a bigger systematic problem of American health and food production that requires complete reform. A system which contributes to inflated food prices, higher healthcare costs, and impedes the possibility of a serious consideration of free healthcare in America. We need reform to tackle inflated food prices and rising healthcare costs. Countries like Italy show us that better diets lead to better health outcomes. But how can we expect free healthcare if we don't address our diet first? In order to have free healthcare, we would need to meet higher health standards coming from our diet, the way European countries like Italy maintain far lower diabetes, obesity, and heart disease rates than Americans. No one is going to be tolerant of higher taxes for healthcare if it's a disproportionate amount of services are going to help people with poor diet habits. We must reform our diet and nutrition situation in America, as well as our overly processed food production, before we can expect a serious debate to be had with critics. If we want free healthcare like Italy, we need to produce food and eat like Italy first. The SNAP subsidy loop. What if I told you? The $96 billion program designed to feed America's most vulnerable is actually one of the largest taxpayer-funded subsidies for the world's biggest corporations. This isn't just about food. It's a story of how your money is used to make corporations rich, Americans sick, and then leaves us to foot the bill. Twice. Part 1. The funnel. Let's follow the money. We're talking about SNAP, or food stamps. Where does it actually go? It doesn't spread out. It funnels. One single company, Walmart, captures over 26% of all SNAP spending. Let that sink in. That's $24 billion a year to one company. To put that in perspective, the next closest competitor is Kroger at just 8%. This isn't a free market. It's a taxpayer-funded monopoly. In fact, over 80% of all SNAP benefits are spent at large-format superstores. Part 2. What are we paying for? So, Walmart gets the cash, but who are they paying? Who is really cashing the check? It's not your local farmer. The top 10 manufacturers benefiting from SNAP are a who's who of ultra-processed food: Post, Tyson, Conagra, Kraft Heinz, PepsiCo. The data is shocking. For every SNAP dollar spent, 20 cents go directly to what the USDA classifies as problematic items: sugary drinks, salty snacks, and candy. In total, over $23 billion of taxpayer money is spent on junk food every year. SNAP participants spend nearly 3 times more on sugary drinks than they do on milk. We are, in effect, running a $9.6 billion a year government subsidy for the soft drink industry. This is where the first subsidy ends and the second one begins. We are subsidizing a diet that is making Americans sick. SNAP participants get nearly 60% of their calories from these ultra-processed foods. As a result, only 1.3% of them are able to meet the federal guidelines for fruit and vegetable consumption. And this brings us to the impossible debate: universal health care. How can we ever have an affordable public health care system when another government program is actively paying for the diet that fuels the crisis? We are subsidizing the obesity, the type 2 diabetes, and the heart disease that create our highest healthcare costs. The top beneficiaries of SNAP are big corporations, not local farmers. This system crushes small businesses. It destroys local grocers and regional farms who simply cannot compete with the subsidized giants. We're spending billions on junk food, fueling health crises like obesity and diabetes. How can we have affordable health care when we're subsidizing unhealthy diets? It fuels inflation. When corporations know that $96 billion will be spent, they can keep raising prices. SNAP will cover it, but you, paying from your own pocket, are stuck with the same inflated bill. This is crony capitalism at its worst, crushing small businesses and fueling inflation. And it empowers the worst actors. When billions of your dollars are guaranteed to flow to companies like Nestlé or Tyson, it validates their entire business model, including, in Nestlé's case, the documented use of child slavery in their cocoa supply chains. We've turned a vital food safety net into a corporate subsidy, and it's time to change that. Conclusion. This system is not working for the taxpayer, it's not working for the small farmer, and it is not working for the people on SNAP it's supposed to help. It works for one group, corporate bottom lines. We've turned a critical food safety net into a corporate subsidy. The government is paying the biggest corporations in the world to make the worst possible food for the most vulnerable people, destroying their health, and then sending all of us the bill.